Are you ready to discover some uncomfortable truths that could revolutionize your approach to health? Every year, millions of older people undergo routine medical checkups, convinced they're protecting their well-being. But what if I told you that some of these tests, the ones you're strongly advised to have, could actually push you toward unnecessary surgery, strokes, or even increase your risk of cancer? Get ready to challenge convention and take back control of your health. We live in an era in which medicine has made great strides, offering increasingly sophisticated diagnostic tools. However, this abundance of technology has a downside, especially for the elderly. New studies reveal that up to 37% of medical tests in those over 70 lead to unnecessary treatments, unexpected complications, or permanent side effects. It's shocking to think that 99% of people over 70 are unaware that they are potentially over-investigated. This phenomenon, known as over-medicalization, isn't due to bad faith, but often to standardized protocols, fear of missing out, or sometimes financial incentives. Our goal isn't to demonize medicine, but to provide you with the information you need to make informed decisions. In this video, we'll reveal the 5 most common checkups that, after age 70, could do more harm than good. I guarantee that once you know this information, you'll never make a doctor's appointment again without careful consideration. Your health is a precious asset, and you deserve to be fully informed. Let's start with a test that seems harmless, almost routine, but could silently undermine your peace of mind and health. A bone density scan, or DEXA scan, is a quick, painless, and non-invasive test. It lets you know if your bones are at risk of fractures, which may seem useful information. However, what's often overlooked is that, after age 70, a DEXA scan can generate more anxiety than real benefits. This is because bone density loss is a natural and inevitable part of the aging process. Our bones, like the rest of our body, undergo structural changes as we age. In older adults, especially postmenopausal women, DEXA scan results almost always show reduced bone density. This occurs even when there is no imminent risk of fracture. This condition is often labeled osteopenia, a mild reduction in bone density that is not yet osteoporosis. Faced with these findings, many older adults are encouraged to begin drug therapies, such as bisphosphonates. These drugs are designed to strengthen bones and prevent fractures. However, bisphosphonates are not without side effects, which can include gastrointestinal problems, muscle and joint pain, and in rare cases, more serious conditions such as osteonecrosis of the jaw or atypical femoral fractures. Extensive studies have shown that treating mild bone loss, osteopenia, in people over 70 with medications has little or no impact on preventing actual fractures. The risk of side effects in many cases outweighs the potential benefits. It's crucial to discuss the actual risks and benefits with your doctor, also considering alternatives such as targeted exercise, a diet rich in calcium and vitamin D, and strategies to prevent falls. Let's now move on to a checkup that can trigger a cascade of fears and potentially unnecessary medical interventions. When older adults begin to notice they're more forgetful or confused, the natural instinct is to fear the worst: dementia, Alzheimer's. To allay these anxieties or to seek a diagnosis, doctors often prescribe a brain magnetic resonance imaging, MRI. But here's the inconvenient truth: MRIs rarely provide the answers hoped for in these settings. In fact, most brain MRIs performed on people over 70 show only age-related changes. These may include a slight reduction in brain volume, atrophy, or small patches of white matter, which are completely normal for advanced age. These findings, though normal for an aging brain, can be interpreted as abnormalities and trigger a cascade of anxiety and further investigation. The patient and their family members can become overwhelmed by worry, leading to specialist consultations, more invasive tests, or even the consideration of experimental treatments. All this without the MRI actually improving our understanding of the cause of memory loss or offering a concrete solution. In some cases, the search for a structural cause of memory loss can distract attention from more common and treatable factors. These include vitamin deficiencies, medication side effects, depression, sleep disturbances, or poorly managed chronic medical conditions. MRI, in the absence of focal neurological symptoms or rapid cognitive decline, often does not add significant diagnostic value. It's more effective to focus on a thorough clinical assessment, specific cognitive tests, and lifestyle optimization. Keeping your mind active, following a healthy diet, getting regular exercise, and managing stress are much more concrete and effective strategies for preserving memory and cognitive function. We're halfway there, and if you find this information helpful, don't forget to subscribe to the channel and turn on the notification bell to stay up to date with our content. Any comments are welcome and help us create ever better content. Now let's tackle checkup number 3, an extremely common test that in certain circumstances can be counterproductive. The cardiac stress test is one of the most frequently ordered tests for older adults who complain of mild fatigue, shortness of breath, or general chest tightness. The goal is noble, to rule out heart problems. However, after age 70, this test often does more harm than good, especially when used on people without clear, specific symptoms of heart disease. The main problem lies in diagnostic accuracy. In adults over 70, the false positive rate for exercise stress testing is significantly high. A positive or abnormal result in an asymptomatic elderly person may not indicate true coronary artery disease. This may be due to various factors, such as changes in the baseline electrocardiogram, medications that affect cardiac response, or simply age-related reduced exercise capacity. A false positive inevitably triggers a series of more invasive and risky follow-up tests. These follow-up tests may include coronary angiograms, which involve the injection of a contrast agent and exposure to radiation. If the angiogram reveals narrowing of the arteries, even if they don't cause significant symptoms, the patient may be referred for procedures such as angioplasty with stenting, or, in more severe cases, coronary artery bypass grafting. These procedures, while life-saving in emergencies or for severe symptoms, carry inherent risks such as bleeding, infection, stroke, or heart attack. For asymptomatic older adults, managing cardiovascular risk factors, high blood pressure, cholesterol, diabetes, and adopting a healthy lifestyle are often more effective and safe. It is essential that physicians carefully evaluate the patient's symptoms and overall risk profile before ordering a stress test, avoiding subjecting older adults to invasive tests based on equivocal results. Now we come to checkup number 2, a procedure many consider a cornerstone of prevention, but one that might surprise you with its risks in older age. Colonoscopy is widely recommended for colorectal cancer screening, and for good reason. However, this procedure isn't always the wisest choice after age 70, especially if there are no specific symptoms or a significant family history. The risks associated with colonoscopy increase progressively with age. Preparing for the exam itself can be particularly challenging for older adults. It requires the use of strong laxatives that can cause dehydration, electrolyte imbalances, dizziness, and falls. These effects can be particularly dangerous for those with pre-existing medical conditions or taking multiple medications. But what's truly surprising is that colonoscopy itself can cause significant complications. These include intestinal perforation, a medical emergency requiring immediate surgery. Other risks include bleeding, adverse reactions to sedation, and in some cases, cardiac arrhythmias or respiratory problems, especially in patients with cardiopulmonary fragility. For older adults, especially those with limited life expectancy or significant comorbidities, the benefits of colonoscopy screening may not outweigh the risks. The growth of polyps and colon cancer is a slow process. If an older adult is already over 75-80 years old and has had negative colonoscopies in the past, the additional benefit of an additional colonoscopy may be marginal. There are less invasive alternatives for colorectal cancer screening, such as fecal occult blood testing or fecal DNA testing. These tests, while less sensitive than colonoscopy, may be a safer and more appropriate option for frail older adults or those who prefer to avoid the risks of an invasive procedure. The decision to undergo a colonoscopy should be personalized, taking into account age, general health, life expectancy, and individual preferences. And finally, we come to checkup number 1, perhaps the most dangerous and potentially harmful for asymptomatic older adults. We're talking about annual comprehensive CT, computed tomography scans, often promoted as a proactive way to detect cancer or other abnormalities early. The idea of seeing everything inside your body may seem reassuring, but the reality is quite different. Here's the shocking truth. CT scans expose your body to a significant dose of ionizing radiation. A single CT scan of the chest, abdomen, and pelvis can be equivalent to hundreds of chest X-rays. Cumulative exposure to this radiation increases the risk of developing cancer over the course of a lifetime. For an older adult who already has a shorter life expectancy, the risk of developing radiation-induced cancer may be lower, but the risk of false positives and diagnostic cascades remains extremely high. In older adults, especially those over 70, the risk of triggering unnecessary follow-ups, invasive biopsies, and even surgery based on incidental findings is extremely high. Full-body CT scans are highly sensitive and can detect small abnormalities that are often benign and clinically insignificant. These incidentalomas may be lung nodules, renal cysts, small liver lesions, or other anatomical changes normal for age. Each scan can deliver so much radiation that it's responsible for a significant percentage of cancer cases. But beyond the risk of radiation-induced cancer, there's the risk of anxiety, stress, and invasive medical procedures that offer no real benefit. Imagine the worry of discovering a small lung nodule that later turns out to be benign, but only after months of waiting, further scans, and perhaps an invasive biopsy. Whole-body CT scans are not recommended as routine screening for the general population, much less for asymptomatic older adults. They should be used only when there is a specific clinical suspicion or to monitor a previously diagnosed condition. Preventive medicine should focus on evidence-based strategies, not indiscriminate tests that create more problems than they solve. Keep in mind that our bodies are complex and wonderful machines, and aging is a natural process. If you feel well, maintain regular checkups with your doctor, but be proactive in asking questions. Always ask the reason for a test, what the expected benefits are, what the risks are, and what the alternatives are. Only take tests that are clearly indicated and have a proven impact on your health and quality of life. Your health is too precious to be wasted on fear-based screenings that could leave you worse off than before. Be an informed patient and actively participate in decisions that affect your well-being. The best medicine is one that puts you at the center, not just an object of investigation. Have you ever faced complications from a medical test or treatment that proved useless or even harmful? Your experience could be valuable to others. Tell us your story in the comments below. We're here to listen, offer support, and build a community of informed people. Don't forget to share this video with anyone who might benefit. Together, we can promote wiser, more person-centered medicine.